So you guys have all of the veins. We'll start with the veins just because they're nicely labeled. Okay, so your heart, the thing that comes off the top is superior vena cava, right? Okay, remember there's that vessel that runs right, it drains the heart, so it's coming off of the vena cava, but you can see it going right above the heart, right? That's our azygous vein. Okay, so we travel up. The very next vessel that comes and drains into the vena cava is our vertebral vein, this little guy. Next vessel that drains in goes out to the chest wall, so that's our internal thoracic or mammary. I don't care whichever one you want to write down. You can see our vein, the artery always sits right next to it. Okay, this guy. So any vessel, the only vessel that's going to run from the center of the body out to the chest wall, internal thoracic. Okay? All right, then we follow up. Our vein has a Y at this point, right? You've got two pieces coming together. These two branches that make up the Y are brachiocephalic veins. I think that one of the hardest things to label is this little piece. So you've got the Y's of your brachiocephalic veins. You've got the external jugular coming down. This little tiny section before it branches again, subclavian. It's just a tiny section. Okay, so subclavian and the external jugular were the two parts that come together into brachiocephalic. So external jugular goes up. We go this way. It's so nicely labeled. I'm trying not to mess it up. So subclavian's our little section here. We go into the armpit as soon as we're over the chest wall. In the cat's armpit, axillary. Okay? There's our axillary artery too, axillary vein artery. And then as we move down into the arm, anywhere in here is brachial. Okay? Good. So the only thing we did not find on here is costocervical vein. I'm not going to pin it. I literally do not remember where it is from last year, and it's not even in your book. Okay, so we won't pin that one. Okay, so the only other ones we're missing, the jugulars. So if you're deep, the internal jugular actually comes off the external jugular. So, but you can see it's really deep, right? It's sitting right here up against the trachea. Only thing that runs across the cat up at the top is our transverse jugular. And then these ladies nicely have the other two facial veins labeled. Anterior means front, right? So the one that runs to drains the front of the face is anterior facial vein, posterior facial vein. Okay? With regards to the arteries in this spot, I'm pushing along, push it out of the way. Okay. When you're looking at the heart for the arteries, there are two pieces that branch off, right? So this part, if I put a pin up here, this is our aortic arch. These two branches. This here is our brachiocephalic artery. On the left side of the cat, it branches right away into subclavian artery. That's different than the veins, right? If we follow the subclavian artery, I want to show everybody this because these are very hard to find, and there's only a few cats where we found these. There are 4 branches off of this subclavian artery. The first one is teeny tiny, and it shoots down like kind of like at an angle like this, and it's running up to the head. That is the vertebral artery. I'm holding it up right now. It's teeny tiny. So I will potentially pin vertebral artery, but not, sorry, it's costocervical that you have to know. You know vertebral vein, it's huge. It's on the other side, it's a big. The next branch off of subclavian is this little guy. See how it makes a C and it curves up and down? Costocervical artery. But I won't pin the vein. Okay? So I always go, you've noticed I follow things in an order. That's the way it's easier for me to learn it that way, and then I can remember and orient where I am, right? So subclavian, vertebral, costocervical. This thing is thyrocervical. You don't need to know it, so don't care. This thing runs out to the chest. So that's our internal thoracic or mammary artery. Okay? Then if you follow our brachiocephalic artery up, you've got your two branches of your common carotids. Then after those branch off, that's where you finally see the right subclavian artery. So the left is the one that shoots up right away. The right is on the right side, but it's after carotids break off. As soon as I pin anything in the armpit, you know what? It's axillary, right? Into the arm brachial. The other thing I want to point out to everybody that I know a lot of you haven't seen are the stuff in the middle of the abdomen, because a lot of times they come off when you're dissecting. Gosh, this looks weird right now. This was the one we were working with, right? Wasn't this the one we were working with? Did it have my name on it? Oh, there it is. This one's not as pretty, but if I hold it. Okay, so when you're looking at the abdominal aorta, right, that's running through here, I hope you can see there. Okay, there are 3 branches that come off like this, the center of the aorta, 3. The top one here that you can see has more branches and it's running to the organs. That is the celiac trunk. Okay? The second thing that comes off here, and we accidentally tore it, but this is the second branch and it would connect here. That is the superior mesenteric artery. The inferior mesenteric artery is way down here. So notice it's past the kidneys, past the gonadal stuff, and it attaches to the colon. Okay, so 3 things. Celiac trunk, highest up, and you'll notice it has lots of branches. Superior mesenteric, inferior mesenteric. When you are up by the celiac trunk, there are 3 branches that you need to know. And I think these are the other 3 hardest things. So note that we've got our celiac trunk, and we accidentally, this is the one we worked with because I cut this accidentally. So here's our celiac trunk. Notice you've got 3 main pieces. 1, this one I accidentally ripped. 3. So you've got your hepatic artery, your splenic artery, and your gastric artery. So they all serve those organs. So you just want to figure out, where am I going to, right? So typically the first one, depending on how you look at this, notice how this guy is going deep into the body cavity. That's our hepatic artery, okay? So the thing that branches off and you can't really see what it's going into, but it's running deep and underneath, and it actually comes through on this side, hepatic. The next one's easy because look what it's doing. It's right here. So we've got 2 little branches, but what is it going to? Look at, they're both attached to the stomach. So that's gastric. And our final one, which was this guy, which I accidentally ripped, but it ran all the way out to my spleen. Okay, so typically how it runs is hepatic kind of runs off the bottom first and goes towards the back. Gastric is sort of in the center, and you'll know it's, if you trace it, you guys can see this, right? This is the stomach, this thing. Look where these branches are going, right to the stomach. I feel like the gastric one's the easiest to find. You're like, okay, it's definitely attached. And if I pin a splenic, it'll be on a different cat because I want to make sure you see that it runs all the way out to what? The spleen. Those are hard, okay? Then we travel down. Everybody did a great job finding their renal arteries and veins, right? This little guy hanging out, nestled all cutely right here. Here's our adrenal gland. So our adrenal lumbar artery is right here. I can't remember, do you need to know the vein too? It's sitting right there if you do. Okay. Following our vena cava, the next little branch that comes off is our gonadal artery. On this side you can see the vein. It's bigger. Then finally we reach this branch coming off to the colon right here. This guy. So that's our inferior mesenteric. The 2 little guys that come off to the side, iliolumbar. And then you're finally down in the limbs. And I feel like everybody has done a pretty good job down in here. So with your arteries, remember your first Y that you see, the very first big Y with the arteries are external iliac arteries. The little ones on the inside are the internal iliac arteries. The vein, the artery that runs down the very center, and it's teeny tiny, it's hard to pin because it's like sitting in bone and it's really deep, median sacral artery. With the veins, it's a little different because the biggest part of the Y is common iliac vein. Then you've got a teeny tiny vein that's going to be really hard to pin, so I may not pin it, that runs deep into the body cavity. That's your internal iliac vein, and as soon as you find that, then you know this part here is external iliac vein. We run. If there's a pin in this outside piece right here, great saphenous vein or artery, right? So we turn as soon as we're external iliac vein. As soon as we're right here in the thigh, we know it's femoral, right? Artery and vein. So the last 3 that we have, which are pinned out really nicely in the back corner. So you can go over there and look because they're labeled. Okay. So here you can see how the femoral artery and vein, they continue on the surface as the saphenous, right? But they also run deep into the knee or behind the knee. That's the popliteal artery and vein. And then if you look on that back cat, you go a little bit deeper and you've got 2 branches that come off this guy. One that runs deep to the back, so that's posterior tibial artery, and one that kind of runs up towards the front, and that's anterior. I think we did them all.